The story I will introduce this time is about the treatment methods for dogs suffering from necrotizing fasciitis, which is almost the only treatment available. In fact, for dogs like Comey, which I will introduce today, there were virtually no other treatment options available besides this one. So, after seeing the treatment today, it may be worth considering for dog owners in similar situations to treat them with necrotizing fasciitis methods. In the case of mammary tumors in senior dogs over 15 years old or small dogs weighing less than 3 kilograms, it is extremely challenging to opt for anesthesia or surgery. So, in such cases, most of the time, after being diagnosed with a tumor, they often choose to leave it untreated. Then there are many cases where the tumor has grown quite large. In such cases, treatment becomes very difficult, and recovery after treatment is often quite challenging.
This is a method for removing mammary tumors in such situations.
Comey was a toy-sized Yorkshire Terrier weighing 1.3 kilograms. She was a spayed female, approximately 16 years and 3 months old.
The location of this tumor was not ideal. It was situated right next to the reproductive organs.
So, the primary goal of this treatment was to necrotize the tumor and remove it.
During the tumor necrosis, it was important to protect the urethra and the vaginal part of the reproductive organs.
The objective was to necrotize only the tumor while preserving those areas.
1.3 kilograms Yorkshire Terrier. Is it 15 years old? It's 16 years old. Is it 16 years old? Yes. I cannot perform anesthesia or surgery.
As you can see, treatment began around April 22nd. Therefore, after the process, the treatment was fully completed around June 10th. If you look at the first treatment received on April 27th, this here is the genitals. This timestamp is precisely marked on the genitals. The genitals are in this area, and adjacent to it is this tumor, an adenoma. Then there were 2 more mammary tumors in this area.
So, if you look up here, this is the photo from April 29th. This area here is the reproductive organ.
And right next to it, there is 1 mammary tumor positioned like this. There was 1 more mammary tumor over here. I only received the first treatment. Fortunately, after the first treatment, the prognosis was good and necrosis progressed immediately. Starting around May 7th, it became apparent that due to necrosis, the tumor began to show signs of melting away. Now, it's May 23rd. At this point, because of the necrosis of the tumor, this pus was being released.
The owner had a really tough time dealing with the smell of the pus.
So they told us it was very difficult and that the smell of the pus was quite distressing.
At that time, they even wondered, was it really necessary to do this?
Now, after we removed the pus sac from the tumor, it looked like this.
This is a reproductive organ that has turned very black like this. It's kind of fascinating, right?
During the necrotic reaction, the surrounding tissue turns this black.
Fortunately, it didn't significantly affect the urethra and vagina.
So if you look here, the section that was opened is gradually getting smaller.
Well, the color of this genital area is gradually coming back.
This genital area that had darkened is regaining some color. Like this, like this, like this, and like this. Around June 8th, the necrotic and lust areas of skin have mostly healed. Thus, on June 10th, the skin that had completely necrosed and been lost has healed, concluding the treatment. This treatment is appropriate for elderly dogs or cats that can no longer undergo surgery. Additionally, for dogs and cats that cannot be anesthetized due to underlying conditions. Or for very small dogs at high anesthesia risk, like a 1.3 kilograms dog named Comey, anesthesia is nearly impossible. This is an appropriate treatment for breast tumors in these animals. Currently, I have around 15 animals receiving this tumor treatment. And if we combine all the children we've had so far, there are just over 30. The number of tumors has now exceeded 100. Since we've been doing many treatments, the guardians have some misunderstandings. We can now destroy and remove the tumor, but essentially, this treatment cannot prevent the development and recurrence of cancer.
Cancer cells are generated daily at a rate of approximately 3,000 to 5,000.
You can consider it as our body continuously eliminating them. Thus, I can help remove the problematic enlarged tumor without surgery.
I cannot stop the occurrence and recurrence of cancer.
In that aspect, we can lower the chances of occurrence and recurrence through treatments like chemotherapy or immunotherapy. The explosivity and recurrence of cancer are fundamentally beyond our control. Additionally, there are 4 types of breast tumors that may not respond to first-line treatments. Fortunately, in Comey's case, it was treated with first-line therapy. However, we cannot determine which of these 4 treatments the tumor will respond to. As you've seen, the removal of breast tumors takes a considerable amount of time. I generally indicate a time frame of about 100 days for the initial treatment. Typically, after necrosis has progressed, it takes about 60 to 70 days afterward. You can consider it to take just over 2 months. During the treatment process, we disinfect that area, clean it, and if pus occurs. Caring for such issues requires considerable management. In a situation where the guardian is realistically struggling to manage the puppy. In fact, I do not recommend opting for this treatment method.
During my 24 years at an animal hospital, I have encountered many cases involving puppies, particularly those of extremely elderly
When
dogs.
mammary tumors develop in small breed puppies,
many cases exist where standard treatments, such as surgery and chemotherapy, cannot be administered. Because if you choose something like that mechanically, there are many cases where people cannot endure anesthesia and surgery.
And even choosing chemotherapy almost results in kidney failure.
Or liver failure occurs, or quality of life significantly deteriorates. In fact, in such cases, surgery following the standard chemotherapy outlined in books is performed. When undergoing chemotherapy, you can't take these factors into consideration. It becomes a situation where nothing can be considered. In such cases, we recommend treatment with our necrolysis method. We highly recommend it.